Sorry, I was on mute. So we'll just go ahead and start. I don't know if you can see my screen, but all right. So good morning, good day, everyone, and welcome to today's webinar, Unlocking Nigeria's Health Data. So exploring open science with the IHME GBD compare tool. Um, I am incredibly excited to have you all join us today. As much as we have little people, it's okay. I'm so excited to be doing this. Um, as we explore how open science and powerful data tools like the IHME GBD Compare tool can help address Nigeria's health challenges. So as we move on to the presentation, please feel free to submit any question you may have in the Q&A or in the chat, and we will address them during the Q&A sessions. Also, additionally, feel free to introduce yourself in the chat. Would love to know where you're joining us from and a little bit about your background. So do not hesitate. Okay, so my name is Nabila Salisu. I'm actually a public health data scientist and open science community Nigeria lead. Um, I've always dedicated my work life just promoting open science and improve health outcomes. I have worked with various international organizations to implement open science initiatives that support data-driven solution for public health challenges. Also, my dad is originally from Nigeria, from Kano, so I am Nigerian as well. So today, briefly, what we'll be learning. I'll be talking, giving an overview, introduction to open science and its importance for public health in Africa. We will also be exploring the IHME Global Burden of Disease tool and also identifying priorities using open science data and how can open science data influence policy and decision making in Nigeria, right? And what will be the future of open science in Africa, the opportunities and challenges that we're actually currently having. To begin, let's explore the concept of open science and why it's becoming increasingly important for public health in Africa. So, open science refers to the practice of making scientific research, data, and methodology accessible to everyone. So, by embracing open science, researchers and institutions break down barriers to knowledge sharing and collaboration. This fosters a more transparent, inclusive, and also efficient scientific community. And as members of the open science community in Nigeria, we are motivated by the vision of making science more open and accessible to improve the quality and efficiency and the impact of research and education in Nigeria and beyond, right? So our goal is just to inspire discussions about open science like we're having today among stakeholders and also in Nigeria and also help empower communities to use data to improve health outcomes, right? So why does it matter, right? Why does it matter? This is a big question, especially in Africa. So in Africa, and particularly in countries like Nigeria, adopting open science has the potential to drive evidence-based decision in public health. Um, as you know, there is a lack of accessible and high quality health data, and open science help bridge this gap by making data freely available with open access to health data. We can gain a clearer picture of health challenges across the continent, right? We can track trends, identify emerging disease, so on and so forth. This is particularly important for addressing health crises like infection disease, maternal health and child health, and also non-communicable diseases that disproportionately affect African populations. So by working together, we can tackle health issues that go beyond national boundaries, like pandemics, and also the spread of disease such as malaria, HIV/AIDS, and tuberculosis. Also, by making scientific tools, data sets, and research outputs freely accessible, open science democrat, just makes these tools freely accessible, right? It empowers innovation and empowers African researchers to lead the importance of solving their own public health challenges. This is a key and important aspect, right? Just to ensure that research is not only relevant to the needs of African communities, but also directly applicable to in local context also. So open science is just not a buzzword. It is a powerful tool that can transform Africa's health landscape, and also enables transparency, foster collaboration, drives innovation, and also empowers individuals and communities. So it was important for me to just talking about open science. I wanted to add this before we actually get into the 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 real thing, the IHME tool. I wanted to discuss the fair reproducibility, um, which is an essential principle in the open science movement, right? Ensures that scientific research can be reliable, reproduced, and verified by others, right? Fair reproducibility. What is fair reproducibility? So fair reproducibility is a cornerstone, right, of open science. It means that research output, such as data, methods, and results, are not only publicly available, but are also structured and presented in a way that others can easily access, understand, and replicate the work, right? So this is important because reproducibility is a key factor in ensuring that validity and reliability of scientific findings, right? If a results cannot be reproduced, it undermines trust in the science itself, and the FAIR principles, which is findable, accessible, interoperable, reusable, are the guiding framework for ensuring reproducibility in the scientific research. These principles are ensure that data is organized, right, documented, and shared in a way that make it easy for other researchers to find, use, and build upon it. So now, how does the IHME, the Institute of Health Metrics and Evaluation, contributes to this principle of fair reproducibility? So the IHME's contribution um, is that the IHME makes a significant contribution by just sharing the vast amount of health data that we're going to explore today from the Global Burden of Disease, GBD study. So this data is made publicly accessible and is structured in a way that allows other researchers, policymakers, public health professionals to find and use. This is free, accessible, everybody can use it. You don't have to sign into anything, right? It's available for everybody. So this data is made publicly accessible, and it's structured in a way that allows everybody, whether it's trend in disease burden, risk factors, or cause of death. The IHME's data, it's open and findable through platform like the GBD Compare tool we're going to explore. And also, this transparency is important because that supports the reproducibility of research findings, and encourages others to verify and build upon the IHME's work, right? So the IHME's is also um, committed to making its methodologies open and reproducible. So the method used in the GBD studies, such as statistical modeling and data analysis techniques, are made publicly available, right? So um, we're gonna go now. I'm just gonna give like an overview of the Institute of Health Metrics and Evaluation, because and its pivotal role in global health research. So a little bit of a background on IHME. Um, IHME is an independent global health research center that is based at the University of Washington here in the US, founded in 2007. So it was created with the goal of improving the health of populations by providing comprehensive data and analysis on health trends and outcomes worldwide. Since its inception, the IHME tool IHME, the Institute of Health Metrics and Evaluation, has become a leader in the field of health metrics, right? Working to generate data that informs decision making um, for policymakers, for researchers and health professionals around the world, right? So the IHME conducts the Global Burden of Disease, the GBD study, one of the largest systematic efforts to quantify health trends globally. So this initiative tracks like over 250 or 3,300 diseases, injuries, and risk factors across 195 countries, right? So providing data on more than 2 billion results. This is impressive for me, actually. When I learned about the IHME, I was very impressed at the amount of data the institute had. So the IHME's focus is to produce actionable data-driven insights that can guide health interventions, resource allocations, and also policy decision. So their work has been crucial in identifying key health priorities, highlighting also emerging health threats, and tracking progress towards global health goals, such as the United Nations Sustainable Development Goals, uh, and also one of the IHME's flagship initiative is the Global Burden Disease Study. So I'm just gonna check a little bit in the chat if people have any questions. But I don't think there's any questions. So as we were talking about the GBD, the GBD study tool that we're gonna actually explore today, I wanted to give some important definitions before we actually go on the tool and demo and do a demonstration. So the GBD, the Global Burden of Disease, right, study is one of the most comprehensive systematic assessment of the world's major health challenges, right? So its primary purpose is to quantify the burden of disease, injuries, and risk factors that affect populations around the globe. So the GBD study measures health outcomes by tracking years of life lost due to premature death, which is YLLs, and years lived with disability, YLDs, from various disease, injuries, and risk factors. This comprehensive approach allows us to understand not only the impact of these health issues, but also the disparities that exist between different populations, regions, and countries. So, by providing detailed insight, the GBD study helped us identify the most pressing health concern in a specific country, region, or globally. The GBD study aims to provide a comprehensive assessment of the global health landscape, right? Like I said earlier, tracking over 300 disease, injuries, risk factors. This broad scope ensures that no major health issues goes unnoticed, from infection disease, chronic conditions like heart disease, cancer. It also accounts for a wide range of risk factors, including environmental factors like air pollution, um, lifestyle factors like smoking and diet, and even mental health. So, for countries like Nigeria, the GBD study provides detailed country specific data that helps us understand the exact burden of disease. This includes insight into which diseases are the most prevalent, how health outcomes differ by age, sex, and socioeconomic status, and how these issues evolve over time. For example, the GBD study might show that while infection disease like malaria are still significant contributors to the disease burden in Nigeria, non-communicable diseases like hypertension and diabetes are becoming increasing concern also. So really interesting stuff here. And in addition to just tracking the disease and injuries, the GBD study also focuses on identifying and quantifying the risk factors that contributes to poor health outcomes. So these are behaviors, environmental factors, or conditions that increase the likelihood of developing disease or injuries. Um, why are risk factors important? So, understanding risk factors is crucial because it allows us to address the root cause of health problems. By identifying the key factors that drive diseases such as smoking, unhealthy diets, or air pollution, we can design more effective prevention strategies to improve public health initiatives and ultimately just reduce the disease burden. So while the GBD study disaggregates like health data by factors like age, sex, and region, it does not currently include social determinant of like wealth, education level, religion, ethnicity in its core analysis. I just wanted to like emphasize on that. So the GBD does not include social determinant like wealth, education level, religion, or ethnicity. So these social factors often play a critical role in showing what health outcomes and also could provide a more nuanced understanding of health disparities, right, within and between countries. Um, so the GBD study focuses primarily on quantitative data, such as disease prevalence, mortality rates, disability adjusted life years, um, and um and more. We'll show it later, but these metrics are useful because they help understand the disease burden, and they may not fully capture the qualitative aspect of health, such as the emotional social impact of living in certain condition. For example, the impact of chronic mental health um, disorders may not be fully represented. Okay. Um, and then DALIs. When I will be demonstrating a little bit of on the tool, you'll see DALIs, right? DALI, disability adjusted life years. What are DALIs? So DALIs are one of the key metrics used in the GBD, right? Study. DALIs, or again, disability adjusted life years, are a measure that combines both years of life lost due to premature death and years lived with disability due to illness or injury. So it provides a comprehensive view of the overall health burden in a population. And also, the year of life lost, this is a component of Galley's measure, the premature death um, caused by a disease or injury, right? It is calculated by taking the difference between the age at death and the expected life expectancy. For example, if someone dies from a disease at 50, age 50, and the life expectancy in their country is 80 years, the years of life lost for that death is 30 years. This part of the DALI, the years of life lost or years lived with disability, measures the impact of disease or condition that caused temporary or permanent disability. So it reflects the severity and duration of the disability. For instance, if someone is living with a chronic condition like diabetes or depression, they are considered to have a certain number of years of life lived with disability. Um, the longer the duration and the greater the severity of the condition, the higher the YLD, years lived with disability. So I'll say it again, the longer the duration and the greater the severity of the condition, the higher the YLD. So by combining both YL and YLD and the DOLLIes, um, we that it provides a single measure that reflects both fatal and non-fatal health outcomes, offering a more complete picture of the health burden in a population. For example, while heart disease may result in higher mortality, chronic back pain might result in a lower mortality rate, but high disability, which is captured through the years lived with disability. So why are DALI important? I think I already explained it earlier a little more about DALIs, but I'm gonna go ahead and also just mention that it allows us to compare the impact of different diseases and health condition on a population, even if they affect individuals differently. So whether by causing premature death or long-term disability. This metric is critical for identifying which health issues cause the most loss of healthy life and should be prioritized for intervention. For example, in Nigeria, a disease like malaria, maternal disorders, and neonatal disorders can contribute significantly to both um, years life lost and years lived with disability, indicating that these areas need targeted um, public health strategies to reduce both death rates and long-term disabilities. Gonna see if you guys have any questions. Um, by the way, okay, before we go, I just wanted to check the Zoom chat. Okay, so there's no questions. That means everybody understood DALIs, the YLL and YLDs, which is great. Um, so we will, yes, like Naima said, if you have any questions, just drop it in the chat and then I will make sure and ensure I answer them. Can you hear me properly or just making sure? 1 second. A little bit of technical. Okay. Um, so I'm gonna go ahead and just turn off my camera because this portion of the presentation will be on the other two on the tool. So I'll go ahead and just turn off my camera and go back here. So now let's dive into one of the most powerful tools for understanding global health, the IHME Global Burden of Disease. Click on that. Okay. As you can see here, this is just the first when you go into the tool, the GBD tool, um this is the interactive platform that will allow us to explore a vast amount of health data, right, from around the world. The tool will allow us to track health trends, understanding the impact of specific diseases, and also compare data across countries and region. For example, it will help us see how diseases like malaria, hypertension, maternal health have evolved in Nigeria over time. And also by visualizing disease trends, we can better understand where to focus interventions and resources. So in the comment section, I will demonstrate how we can use this tool to analyze Nigerians' health data and draw conclusions that can guide our public health actions. All right. So um, on the main screen, you can see several options to filter data. I'm just gonna do here. Um, so this control panel you can manage chart settings via the control panel here. And these buttons up here, there is like a single charts type, explore button, it's a map and one additional chart type. And then the compare button is two of the same chart type. I just wanted to give a little bit of or just exploring the interface on the main screen. So on the second control, you can also like update the data displayed in the charts using the settings. And the settings vary by chart type, and also in explore and compare modes control. They are grouped by chart type, right? So you can both drive both chart and also use advanced setting here to provide more options and finer control. So these are the different charts type they have. So we have a map here. This is like a world map. We have a tree map. We have a risk by cause map. Um, also have the arrow diagram, um, pyramid, the patterns one, an overlap map, a heat map, and a plot, a line map, and also a decomposition map. Next here we have, you can share it with your friends, your collaborators, your coworkers. Um, so the current, like here, like it says here, the current settings for the GBD compare It generates a shareable link, and you can share the link to directly someone. And also it is in high resolution. You can also screenshot your visualizations. So by clicking on a location, for example, in the map, here's on the world map, you can change the location and on countries and see, for example, here, this is Nigeria right there. Also, by clicking on the figure in the bottom chart here, you can also change how it displays. Like, for example, you see here is like it changes. If we go, for example, the burden of this is COVID-19. It changes in the map, in the world map. And here you have the chart and info. You can click in the info button for description of the chart, or also click in the arrow just to expand and reduce a chart size. So the map displays countries and also estimates. So you can hover over the map or a dot, right here. For example, here's like Lesotho. To see detail, the rates of disease and stuff like that. And then the tree map is just a square, these little squares, pie charts that displays causes grouped by hierarchy. I just wanted to like go a little deeper on the squares. So these squares, as you can see here, are, second, there are the diseases, right? Which the size of the box actually matter. So the size of the box just represent the magnitude of a particular disease, like how big it is. Larger boxes indicates that that the disease, for example, here, that the disease or risk factor, this is the global one, for example. The disease or risk factor contributes significantly to the DALYs, right? The disability adjusted life years of life lost. So for a specific country or region, for example, if malaria is a leading cause in if malaria is a leading cause of DALYs in a region, its box will appear larger. So this is the global map is not as large, but as long as we go deeper into maybe African countries, you'll see malaria box it's larger. So it will appear larger and it will signal its major impact on health. And also you see these tiny small boxes conversely represent diseases or risk factors that have a lower impact on the overall burden of disease in that region or country. And also the color of the box typically reflects the type of health outcomes, whether it is a disease or a risk factor. So it may indicate the trend over time, whether the disease burden is increasing. So for example, infection disease like malaria might be in one color, while non-communicable disease like heart disease might be another color. So the blue ones are usually like non-communicable diseases, and these colors a little deeper are infection disease, communicable disease. So in summary, just size of the box is just the magnitude of disease or risk factor contribution to overall health burden. So larger means more significant, and the color of the box, type of disease, risk factor, or the trend of health issue over time. So these visuals cues make it easier to just interpret the data at a glance, allowing users to just quickly identify which health issues are the most pressing in a specific countries or region and how they've changed over time. So, okay, so risk by cause. Um, we have here the risk by cause chart that displays total burden by risk factors and how risk factors affect the causes group. So here you can add, like, for example, you can clear the selection. This is the global map, right? So we can, for example, put communicable disease, um, just wait a little bit and see how, in group one, those risk factors by cause, which is behavioral, environmental, metabolic, shows. I'm gonna clear the selection here. And then the arrow diagram also displays like change in the rank of causes or risk between 2 years, right? From 1990 rank to 2021 rank globally, we can see that in 1990, the rank maternal and neonatal rank higher, but in 2021, we can see like globally, cardiovascular diseases is ranking higher. So the pyramid chart also displays like causes or risk attributed to cause by sex. The chart includes one or more locations, a single year, I think because I removed locations. Also, you can switch the causes or risk here. Add a single cause. Maybe let's put AIDS, like a single cause. So you can see how in countries, you can see how in South Africa, and you can actually even compare to male and female, which is a good thing. The pyramid chart can help visualize. Um, The pattern chart displays just trends for causes or risk among different ages of group, location, years, and sex. For example, the location is here. Also change your location. You can see like Ukraine, Kenya, South Africa, because I put the cause, the HIV cause, we're looking at one single cause here, but you can also add multiple, just to kind of see like globally at the landscape, what is trending higher and between age, years, and sex. The overlap map just displays the burden of a single or multiple risk factors. And then we have the heat map that also displays like top ranked causes or risk for different locations at the same time. We can see here multiple country because this is the global map. And then we have the plot chart that displays uncertainty interval by year, sex, cause, location, and then the line. This chart also displays how pauses contributes to the change in life expectancies. For example, you click a decomposition bar to see which causes led to an increase or a decrease in life expectancy. And also you have like additional resources here, publications, and you can also get training on the GBD. All right, so now to drill down further, we will explore actually let's zoom out of the global because this is the global level, and we will begin selecting Nigeria as a country of interest, right? So this is United States. We're gonna put Nigeria here. Okay. So as we filter the data to Nigeria, you can see a more focused snapshot of health metrics. Notice that the tool provides you with several data points, such as life expectancy, mortality rates, disease burden and more. So you can filter this by specific years. Here, specific years you're looking for and other parameters to get detailed insight. So drill down further, let's explore the impact of specific diseases and risk factors on Nigeria's health, which is right here, right? So cause of death in Nigeria, all and both. So for instance, you can see here that the red ones, communicable disease, like malaria, right? And tuberculosis, and HIV disease. So these are like one of the select one of the communicable diseases that um show a burden in Nigeria. So now maybe we can see how the disease burden here compares to other countries in Africa and the world, for example. So we can go here in the compare by location. Right. So the top one is global. Okay, let's put the top one here. We'll put Nigeria in the top one. Oops. And then we can, for instance, compare it to, okay, just look at the difference here, right? This is Nigeria and look at the global map, so you can kind of see the difference of burden, right? We can see in Nigeria, for example, that we're having a lot of the communicable disease burden here, but globally, we have ischemic heart disease that's becoming fastly a huge burden in the world. We have stroke, and in the world, when you compare it, we can see how it is actually significant here. But let's compare it to another African country. Let's put South Africa, maybe. South Africa. Okay. It's a little similar, but you can see how the difference between the HIV burden of disease in Nigeria and in South Africa. You can kind of see the difference, how big it is here. You can also, the key feature of this tool is the ability for you to disaggregate the data by just different demographic factors. For example, we can break down by age, right? Let's break down 15 to 49 years old. You can see the difference. We can also break down by sex. Example, male. This is male, male, 15 to 49 years old, 2021. You can see the difference. From South Africa and Nigeria, we can kind of see the stark difference. And also, we can do both, which is back to where we are, and then age standardizing. Okay, so however, as you can see here, one area that the IHME data tool currently lacks is just the um, disaggregation of data by social variable, such as wealth, education, and ethnicity. These are important factors that influence health outcomes, and the inclusion of these variables could provide even a deeper insights into health disparities. So, also, one of the most powerful feature of this tool is the ability to track how disease burden evolve over time. So let's take a look. We're going to go back to single, and over time, we're going to choose the line plot, right? We'll remove this, and But you know the basics, Dallas, Nigeria. Okay, and then I'm gonna put here the causes. We can compare, for example, let's take a look at malaria over the years. Okay, we can kind of see. Let's filter it maybe from, we can see here how it's Nigeria in 2021, the rates um for Dallas, and we can see here it was high in 2008. It went high and then sudden drop. It's continued to drop. Went high a little bit in 2020, but it's dropping. All right. So, well, we'll begin with take a closer look at go back. We'll go back here to the tree map and take a closer look at the leading causes of death and leading causes of death um, in Nigeria. So on this, you can see that Nigeria faces several key health challenges, right? Which are related to infection disease. I said that earlier. We have maternal health here. Um, Also, for example, malaria um, and diarrhea, diarrheal disease, and lower respiratory disease also. Um, Infections are among the leading causes of death, right? In addition, we have maternal mortality that remains a significant issue, with Nigeria being one of the countries with the highest maternal death rates in the world, right? So now we can start by selecting um, Nigeria, which we did here, um, and filter by leading causes of death. Okay, and then as we can see here, we can compare it with um, events here, compare by location, causes of death, Nigeria. There we go. As you can see, when we do this, we notice that while many of these health challenges are common across the region, um, we can see that Nigeria's you know, maternal mortality rate is higher than the South African one, and even global. When you put the global, compare it to just the global, can kind of see the burden of malaria is also more pronounced in Nigeria compared to like South Africa. Um, and we can also compare, like we did earlier, the disease burden with the line over time, right? We can compare it over time. So next, I think we will compare the impact of specific diseases between Nigeria and um, other countries. So let's begin by focusing on HIV. maybe tuberculosis and malaria, which are three major disease affecting Nigeria. So HIV. Oh, one second. We can actually use um not a risk by cause. Explore here. So you can measure the death, years, all age, HIV, risk factor, and location. Let's put sub-Saharan. Hmm. You put maybe West Africa. Or let's just put globally and see, and then sub-Saharan Africa here. And you can highlight, and you can kind of see here, comparing these deaths, HIV. So you can always like age, since we're comparing between countries, we're gonna age standardized. You can see like behavioral. I'm going back to the pattern. Single one. The pattern. So going back, you can see we're gonna go like I did put a little bit of an overview of what we did here was that so you can see here um the leading causes of death and disability in Nigeria. You can see that you saw earlier that Nigeria faces several key health challenges, many of which are related to infection disease and diseases in maternal health. For example, malaria and diarrheal diseases and lower respiratory infection are the leading causes of death. And also, in addition to maternal mortality, remains a significant issue, with Nigeria being one of the countries with the highest maternal rates in the world, right? So we can also just recap a little bit of the tools now that we have explored how the GBD compare tools helps visualize and compare health trends, especially just using Nigeria's as a case study. I feel like it's time to turn our attention to the policy implications of these findings. Through the GBD data, and we've seen the leading causes of death and disability in Nigeria, including malaria, maternal disorders, and neonatal disorders, and how disease burdens such as HIV, AIDS, tuberculosis, and malaria in Nigeria compare to other regions and countries. Also, the health trend over time showing which diseases are becoming more or less impactful and highlighting the areas that need focused attention. So these insights are crucial for shaping health intervention. Um, and next, I will discuss how Nigerian policymakers and health professionals can use this data to identify priority health issues, allocate resources effectively, and develop targeted public health strategies to improve health outcomes across the country. So let's dive into how open data like GBD tool can support better decision making and help drive improvement in Nigeria's healthcare system. So by understanding which disease and injuries and risk factors contributes to the most to the disease burden, I believe that we at Open Science believe that policymakers can prioritize areas that need urgent intervention. For example, if data reveals a high burden of maternal mortality or malaria, these areas can be targeted for more focused resource allocation and health programs. So by identifying which diseases cause the most premature death or disability, policymakers can direct funding, medical supplies, and workforce efforts to areas where they will have the greatest impact. So, this ensures that resources are used efficiently and that health interventions reach the populations who need them the most. So, open data like the GBD tool can serve as the foundation for developing targeted health intervention. For example, if the data shows that non-communicable diseases like diabetes or hypertension are rising, health programs can be designed to address prevention, early detection, and treatment strategies. So by using reliable tools like the GBD, up-to-date data, Nigeria can develop evidence-based health strategies that are tailored to the country-specific needs, the country-specific needs. So data-driven decision-making will allows for the identification of successful programs that can be scaled in areas where improvement are needed, right? So this contributes to a more dynamic, adaptable public health strategy that evolved with changing health trends and emerging challenges. The opportunities for open science in Africa are immense. With the right infrastructure, Open Data Initiative can accelerate research, promote collaboration, and improve access to health and education. So countries like Nigeria can harness open science to solve unique health challenges, enhance research capacity, and develop better public health system. However, there are also significant challenges. So data access remains limited in many regions, right? And there are issues around data quality, privacy concerns, and a lack of training for researchers in open science practices. Um, Also, some governments may be hesitant to adopt like open science due to concerns about the misuse of data or political resistance. So despite these challenges, the future of open science in Africa and Nigeria in particular, it's promising. So by continuing to promote collaboration, training, and policy reform, we can create an environment where open science become the norm, empowering African countries to address their public health challenges more effectively. And us here at Open Science Community in Nigeria believe in that. And that's why we are making these webinars, this workshop happen, just to be able to promote the open access to so many tools, so many research like the GBD tool from the IHME that we explored today. Well, thank you so much for listening. It was really, really, really nice. I was really, really excited to do this, and I encourage you to explore this tool further and use it for your own work, whether you are analyzing public health trends, conducting research, or planning intervention. Um, you can use this tool, and also there's a training aspect on the IHME. You can also get training there if you feel like, or ask me any questions if you want me to, go in deeper, or you couldn't access to certain data, or you're trying to answer some questions. Yeah. Thank you so much for listening. I'm gonna check here to see if there is any questions in the chat. I don't think there's any questions. So I will turn on my camera. And again, for the few people who joined, thank you so much for joining. We're still trying harder, even though it's not easy in our country to have these discussions and to bring people over for learning. We're all here to learn, and we all want to learn. But we're still gonna keep going and keep trying and keep doing the work so that every researcher, every scientist can have the opportunity to have these tools and know about it and know how to use it. So yes, if you have any questions, if you're interested in joining our future sessions, just go onto our website or opensciencecommunitynigeria.org and join us into this big endeavor. Thank you so much, and yeah, we'll see you in the socials. Oh, I forgot. I actually wanted to drop the link for the GBD tool on the chat. I'll do that so you can have access to it also. Um, Drop it in the chat. And yeah, can go right to it. Thanks again. Bye now.